Understanding Autism Spectrum Disorder, Prevalence, Causes and Clinical Features. Autism spectrum disorder represents a complex neurodevelopmental condition that fundamentally affects how individuals communicate, interact, and process the world around them. Since its initial description by researchers in 1943, our understanding of ASD has evolved significantly, though challenges remain in standardizing research approaches and diagnostic criteria. The condition manifests through difficulties in social communication and interaction, alongside restricted or repetitive behavioral patterns that significantly impact daily functioning. The origins of ASD continue to intrigue researchers, who believe the condition emerges from an intricate interplay between genetic predisposition and environmental influences during brain development. Scientific studies have revealed several structural and functional differences in the brains of individuals with ASD. These include variations in cortical layering, modifications in regions responsible for emotional processing, particularly the amygdala, and notable increases in cortical growth and cerebrospinal fluid volumes. Additionally, researchers have observed alterations in the balance between excitatory and inhibitory neurotransmission, along with irregularities in cellular differentiation patterns. It's crucial to note that extensive scientific research has definitively disproven any connection between childhood vaccinations, including the measles, mumps, and rubella vaccine, and the development of ASD. Several factors can increase the likelihood of developing ASD. Parental age plays a significant role, with both older mothers and fathers facing an elevated risk of having a child with ASD. Medication exposure during pregnancy has also emerged as a significant consideration. Research has shown that the use of selective serotonin reuptake inhibitors, SSRIs, for depression during the latter half of pregnancy may increase ASD risk, even when accounting for maternal depression. Similarly, exposure to medications such as thalidomide and valproic acid during pregnancy has been linked to higher ASD rates. However, research suggests that taking folic acid supplements while using anti-epileptic medications might help reduce this risk. The genetic component of ASD is particularly noteworthy. Families with one child diagnosed with ASD face an increased probability of subsequent children developing the condition. This risk is especially pronounced in identical twins, where if one twin has ASD, the likelihood of the other twin developing the condition is substantially higher. Furthermore, certain genetic conditions, including Fragile X syndrome and Down syndrome, have been associated with an increased occurrence of ASD. The diagnostic criteria for ASD, as outlined in the current edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5-TR, focus on two primary symptom categories: challenges in social communication and interaction, and restricted or repetitive behavioral patterns. Individuals with ASD often display distinct social behaviors that set them apart from their neurotypical peers. These may include difficulties with verbal and nonverbal communication, challenges in forming and maintaining friendships, and trouble understanding social nuances. Many individuals with ASD find it challenging to maintain eye contact, interpret social cues, or engage in natural conversational give and take. Repetitive behaviors form another cornerstone of ASD diagnosis. These can manifest as repeated physical movements or speech patterns, such as rocking back and forth or echoing others' words. Many individuals with ASD display a strong preference for routine and may struggle with changes to their established patterns. This might include specific daily rituals, rigid thinking patterns, or strong attachments to particular foods or routines. Some individuals might develop intense interests in specific topics or objects, often focusing on minute details that others might overlook. They may also demonstrate unique ways of organizing objects or information. Sensory processing differences represent another significant aspect of ASD. Individuals may show either heightened or reduced sensitivity to various sensory inputs. Common examples include strong reactions to certain sounds, textures, lights, or movements. These sensory differences can significantly impact daily life, affecting everything from food choices to clothing preferences and social interactions. The presence of co-occurring conditions significantly influences the ASD experience. Recent statistics indicate that approximately 37% of children with ASD also have an intellectual disability. Mental health conditions frequently coexist with ASD, including anxiety disorders, attention deficit hyperactivity disorder, mood disorders, and obsessive-compulsive disorder. In fact, most adults with ASD manage at least one additional psychiatric condition. Other common concurrent conditions include seizure disorders, sleep difficulties, gastrointestinal issues, and immune system irregularities. Early diagnosis remains crucial for optimal outcomes in ASD. Most diagnoses occur during early childhood, typically within the first 2 years of life, when parents often notice missed developmental milestones or social differences. However, gender appears to influence diagnostic timing, with males more likely to receive diagnosis during childhood, and females often diagnosed later in life or during adulthood. Encouragingly, recent data from the Centers for Disease Control and Prevention suggests improvements in early diagnosis rates in the United States, with children born in 2016 showing significantly higher rates of diagnosis by age 4 compared to those born in 2012. The prevalence of ASD has shown a marked increase over recent decades. According to the most recent CDC surveillance data from 2023, approximately 1 in 36 children in the United States has ASD, a significant increase from the 1 in 150 ratio reported in 2000. Globally, the World Health Organization estimates a prevalence of 1 in 100 people, though this figure likely underestimates the true rate due to reporting limitations and varying access to healthcare services in developing nations. Recent demographic data reveals interesting patterns in ASD distribution across different populations. Current statistics show higher prevalence rates among Hispanic and Asian Pacific Islander children, followed by Black, American Indian, and white children, with mixed-race children showing the lowest rates. This represents a shift from historical data that typically showed higher prevalence among white children. Geographic variation also exists, with significant differences in prevalence rates across different states in the US. Gender differences in ASD diagnosis remain pronounced, with boys approximately 4 times more likely to receive an ASD diagnosis than girls. However, recent data suggests this gap may be narrowing, with 2020 marking the first time that the prevalence in girls exceeded 1%. This shift may reflect improving diagnostic practices and growing awareness of how ASD presents differently across genders. Understanding these patterns and trends in ASD is crucial for healthcare providers, educators, and families. As our knowledge continues to expand, so too does our ability to provide better support and interventions for individuals with ASD, helping them achieve their full potential while embracing their unique perspectives and abilities.